I help run the strategy and incubation at Microsoft Healthcare. We make products like Dragon Copilot, which many physicians in America and abroad use, as well as a diagnostics portfolio with PowerScribe. So, we're thinking a lot about AI agents these days, right? Not just for clinicians, but also for the operation staff in health systems, for the financial staff in health system. And I think the difference between a demo and a pilot is that in a pilot, you have a clearly defined workflow. So not just a big use case like improve discharge, you're kind of really splitting it down into many constituent parts. You have a clear operational owner, of which I think some of the people on this call attending today will be, right? You have a measurable outcome, you have access to data and systems, you have it's kind of basic governance boundaries on what the agent can and cannot do.
I'd like to start off by saying that academic medical centers are uniquely positioned for agentic AI because they combine clinical operations, education, research infrastructure, data governance, trainees, and really with a culture of quality improvement and a culture of evaluation, which I think is going to extend naturally to agents by building local validation pipelines, monitoring systems for errors and bias, and graduated autonomy. Even the best medical centers have missed opportunities. Agents may become even more powerful in chronic disease management, longitudinal follow-up, especially after discharge, even, discharges with abnormal testing results that need to be followed up, but not necessarily keep patients in the hospital. And this is going to make, any medical center, I think, provide more equitable care and more proactive care. In the clinical education realm, the opportunity is equally large. Agents can function as tireless tutors, simulated patients, case discussion partners, feedback engines, you name it, even clinical assistants. And this is going to require a huge shift in educational theory from teaching students how to use AI, and many think that they could teach us how to use AI, to really teaching them how to team up with AI. And I really think the focus is going to be human AI teaming and futures literacy. And these are going to become major competencies in medical education and in training.